Hello everyone, welcome to my YouTube video channel. My name is Ajibola Mbolake. I'm a registered nurse. To my subscriber, I said welcome to my channel again. And if you are viewing me for the first time, welcome to my channel as well. My channel is all about enlightening families, individuals about health challenges, conditions, issues that can be prevented if individual has the knowledge to do so. So today I'm talking about another topic, which is human papilloma virus, which can be abbreviated as HPV. Why am I talking about this infection? Because it is a global issue. It is a commonly sexually transmitted infection. So I'm talking about it in order to stop the spread of this infection, and because most horror and throat cancer are majorly caused by human papilloma virus, and likewise cervical cancer is caused by a type of human papilloma virus. That's why I have to talk about it today. But before I continue with this video, don't forget to like my video and likewise subscribe to my channel. What is human papilloma virus? It's a viral infection which is mostly caused by sexual intercourse, and there are ways that individual can contact this viral infection, and some of the ways are through skin-to-skin contact with an infected person. It can be transmitted through deep kissing. Majorly, it can be contacted through sexual activities. It may be oral, vagina, or anal sexual intercourse. And in a rare cases, it can be transmitted from mother to their newborn. What are the signs and symptoms that individual with these issues or infection will shows? Are the following. But in most cases, people who are infected with human papilloma virus may not show the signs at all, but they can still transmit the infection to another person even if they did not show any signs or symptoms. But for people that show signs of the infection, the signs and symptoms may range from sore throats that linger for a very long period of time, hair pains, and the major signs of human papilloma virus is the appearance of warts, which may be flattened warts or elevated one. The type of the warts is based on the area whereby the warts appear. The first type is common warts, which is the major type according to the name. It can be seen in the face or the hands of the infected individual. Likewise, there is filiform type of wart, which is a thread-like wart, and it can be seen in the eyelid or the lips of the infected individual. Another type is plantar warts, which can be seen in the sole of the feet of an infected person. The major type of wart is the genital wart, and since human papilloma virus is majorly caused by sexual activities, genital wart is the most commonly type of wart caused by HPV. The wart can be seen in the genital part of the infected people. It can be seen even in the henna area of an infected individual. These are all the signs and symptoms of human papilloma virus. What are now the ways of preventing the spread of human papilloma virus? Number one is to avoid having multiple sexual partners, and ensure that you have monogamous sexual relationship. The properly use of condom is also a way of preventing this HPV. And likewise, the major way for preventing human papilloma virus or other cancer caused by human papilloma virus is through vaccination. Vaccine is available for teenage boys and girls. You have to contact your health personnel on this. And the vaccine is available in Nigeria, in others developing countries and developed countries. The teenage boys and girls can have 2 doses according to the healthcare provider prescription. And likewise, for women that are sexually exposed already, it's advisable for them to have 3 doses of the vaccine against cervical cancer. But for sexually exposed women or women of childbearing age, it's more advisable for them to have their screening before having the vaccination, so that they can be aware and they can know maybe they have already have the infection or not before having the vaccine. But because if there is infection already caused by human papilloma virus, the vaccine may not be effective or potent as that. So what are some screening that can be done to denote, routinely screening that can be done to denote if there is possibility of a person developing what or having abnormal cells that can lead to cervical cancer later in life? The screening are pap smear, whereby a sample from the cervix of the woman will be collected and placed on the slide to send to the lab and to run a test on it to denote if the individual is liable to have if the person have abnormal cells that can lead to cancer, cervical cancer later in life. And DNA studies can also be done to study the cell sample that was taken to the lab if there is possibility of the person developing cancer later in life, or there is abnormal cells already. And it's more advisable for people that have family history of cervical cancer to do pap smear, and they can also do DNA as well. This is very important in order for them to be on a more safer side. These are the way we can prevent human papilloma virus cause that can lead to cervical cancer later in life. So, and if there is any abnormal detection after the screening, there is treatment modality for the individual. It may be through cryotherapy, whereby the abnormal cells area will be subjected to freezing in order to kill the abnormal cells, and later incision can also be done to remove the abnormal cell. Radiotherapy can also be done, chemotherapy as well, and incision of the abnormal cell can also be done. These are the way to prevent the problem that can later occur as a result of human papilloma virus, or what causing by human papilloma virus. So I've come to the end of this video. Thank you for staying with me to the end, and before next time I'm doing another video, take complete charge of your health. Bye for now.